Breath. We all breathe differently. Some of us breathe in the belly. We're belly breathers. Some of us are chest breathers. It's all fine. Let's just see maybe how we breathe and check in. And without any judgment, just notice how you breathe. It's all okay because things can change to become more efficient, to become more full, to feel really the breath extend as deeply, widely, and as fully in your body as possible. That's what we're going to do here in LifeStretch. So breath. Just notice, take a deep breath, then let it go and breathe normally. And just experience, you can close your eyes or not, and just experience, do you feel like you're breathing in the front where the belly's moving? Do you feel like you're breathing actually in the back? A lot of people don't think that the back moves when you breathe, but if you pay attention for a few breaths, you can feel the ribs in the back open up. Same thing on the sides. Can you feel it move on the sides? If not, it's okay, because we're going to work on that today to experience that. And then finally imagine the top and bottom of your breath here, where it feels like a big beach ball and you're filling it up with air. Can you feel it move on the top? Can you feel it move on the bottom? That's maybe a little more, takes a little more imagination, but it's there. Let's experience it right now. So let's start in the front of our bellies. We can put our hands on the front. Let's just start by finding your belly button, putting your thumb in the belly button, and then resting your palm and relax your thumb. That's where one hand is. Put the other hand over that hand and just relax. Your head is a helium balloon. It's floating up. Your knees are nice and soft. Take a deep breath in and relax and breathe normally and notice, can you feel your belly move on the inhalation? Give it some breathing attention and intend the breath, not forcing it, but think of the breath going there without you pushing it there, without you forcing it there. Just relax and let it go. If you can't feel it, that's okay. Things will change. Take a deep breath and let's release that. We can come back to that some other time. And let's go to the back. So you can take your hands, and I'm going to show you, I'm going to turn around, and you put them right in here. And if that hurts your shoulders, you can put them out to the side, or just keep them straight down if you have shoulder problems. So let's put our hands in the back, in the low part of your back where it feels comfortable, if you can do this. And do the same thing. Take a deep breath and let it go. And now just breathe normally. And yes, you will not feel as much movement as your belly breathing. But think of the air going there, right where your hands are, in the low back. And feel it just fill up a little bit each time you breathe in. Spending time with that, you will notice it will start to move a little bit. And if it doesn't move today, it'll move some other time when you practice this at home. Now let's go to the sides. Your ribs on the sides move like this when you breathe in. And if it doesn't move, that's fine. We're going to see if it does move. So if you can put your hands here on the ribs. If it hurts your hands, your wrists, your shoulders, you can put them down here and just imagine your intention is to move the sides of your ribs. For those that can put your hands here, let's just rest it here and relax. Take a deep breath so you can feel the ribs move, and then ease off on the exhale and let it go, and breathe normally. On the normal breathing, feel if they're both moving at the same time for a breath or two. Maybe one side moves more. So you can intend on where the breath goes by moving the breath into that one side if that needs to move, or into both sides if they both don't move. And if they're both moving, just enjoy feeling the breath intention going to the outsides of your ribs. Take another deep breath and release your hands. And the last thing we're going to do is focusing on the breath, top and bottom. So imagine the whole breathing mechanism on the inside is a big beach ball, and we're filling up the air this way, top and bottom. So you can put your hand here in your sternal area, in your pec, right below your pecs here, in your heart in the center, and then bring it right below your belly button here. And imagine that we're filling up our beach ball of air up and down. Take a deep breath and feel the expansion top and bottom, and then release. And now just breathe normally and notice, can you feel on the inside this movement, this space, this opening with each inhalation? And can you feel it just let go and relax on the exhalation? So it's literally moving into the heart and lung area and down into what we call the perineal area, all the way in the basket of your pubic area. Do a couple more deep breaths to really feel it fill up, and then let it go. One more breath, and lower the hands. And now, just let your hands stay where they are. Bring back your helium balloon head, soft knees, and imagine the entire beach ball of breath is opening front and back where we practiced, out to the sides, and top and bottom. All of it together. Deep breath in, feel that beach ball fill up in all dimensions, and exhale. And again, deep breath in, fill up the entire beach ball, and bring the air where it's a little, has a little resistance. It doesn't quite go where that air should go. Pull in a little bit more and let it go. And one more time, deep breath in, fill up your big beach ball all the way as much as you can, but don't try too hard. And release. And now breathe normally, relax, and enjoy your breath.